plan options, and Ron will be going over the Kaiser plan options. I will now turn the meeting over to Caitlin.
Thank you. Good afternoon, everyone. Thank you for joining. So I'll go over the Cigna portion of benefits that you are being offered this year. There are 3 different plans, so we'll go through those together. If you have any questions, please feel free to stop me at any time, and we'll have some time for questions at the end as well. So next slide, please. Okay, next slide as well. Perfect, thank you. So we have what we call our OAP, Open Access Plus. It's similar to a PPO plan, but that's Cigna's Open Access Plus plan. And in this plan, you have the option of choosing your primary care provider, your PCP, to guide care. It's recommended but not required. You can see a specialist without referral, so you do not need to go to your PCP for referral through the Open Access Plus plan. Using doctors and healthcare facilities in the Cigna network may keep your costs lower. So today I'll focus on the in-network costs. Again, that really is going to save you money when utilizing your care. And then you can choose doctors or facilities not part of the Cigna network, so being out of network, but your costs will be higher. Next slide. So here is, we have 2 Open Access Plus plans. One is going to be high and one is going to be low. So here again, we're going to focus on the in-network column. You see preventative care is plan pays 100%. This is covered 100% by your plan. So that's just getting your annual exam with your doctor. They're taking your blood and you're just going for that doctor visit. So I encourage everyone to do that. Again, no cost to you there. And then we'll look at primary care visit is the $20 for copay. Specialist is $35. Convenience care is $50. Emergency room, you pay $100, and then plan pays 100%. That $100 is waived if you are admitted. Your calendar year deductible for this high plan is $750 for an individual and $1,500 for a family. Coinsurance, after the deductible is met, you pay 20%, the plan pays 80%. And then your out-of-pocket maximum for the year for an individual is $4,000 and family is $8,000. So that's that out-of-pocket maximum, and you will never pay more than that in the year. So again, I focus on that in-network column to save you for cost savings purposes. You will save a lot of money. You can see that the percentage covered in the out-of-network is lower. Next slide. Now this is your Open Access Plus low. So the other one was high, this one's low. Again, preventative care, no copay, no deductible, covered at 100%. That's the same for both plans. Your primary care visit is $40. And then your plan pays 100%. Specialist physician office visit is $60. Convenience care, $50. Emergency room, the $250, same thing here. Then your plan pays 100%, but it is waived if you are admitted. Your calendar year deductible for this plan is $1,500 for an individual and $3,000 for a family. The coinsurance is after your deductible is met. You pay 20%, the plan pays 80%, and your out-of-pocket maximum for the low plan is for an individual, $6,250, and for a family, $12,500.
Does anybody have any questions on that?
Nope. Oh, any questions? So now we'll talk about the health savings account. So again, this is going to be your Open Access Plus network with the same doctors, but the health savings account is where you can put aside the pre-tax dollars. It's going to be a high deductible account, but you can put aside pre-tax dollars to help you pay for that deductible. So you have your medical plan plus your health savings account, which then becomes your tax advantage health savings account or HSA plan. So you combine a medical plan with a health savings account. So you put away that pre-tax money into your health savings account. Provides coverage for current healthcare expenses with the option to save for future expenses. So that health savings account, the money you put in is your money to keep. It doesn't expire at any time. It's yours. You can roll it over year, and then when you turn 65, you can take that out at no penalty.
So if someone wants to do that,
Yep.
they should open up a separate account just for the HSA
Yes.
monies, right?
But you have to be on the high deductible health plan with Cigna or with Kaiser.
Okay.
And you cannot have any other coverage that's not a high deductible plan if you choose this health savings account.
Because the appointment I had this morning, the person said, I opened up an HSA. It's like, but you have the low basis plan. And so his spouse went to the credit union and they opened it up, and you can't do that. You have to have a high deductible qualifying plan.
So is that like a federal regulation or?
It's a federal, yes, it's the law, yes, because they want you to do it, because again, nothing is covered until you hit the deductible.
Yep, so again, in-network preventative care is going to be covered 100%, so that's no cost, that one annual exam with your doctor on this plan as well. You own the account, so as we were saying it, you own the account, it's yours, you carry it with you, roll it over year, you don't lose that money. And contributions are generally non-taxable, and then you have investment options as well. So the money you're putting in, on some HSA banks will let you invest that money to use it as an investment account.
Does that make sense?
A couple of questions. Does this accrue interest, and do you have a ceiling for how much you can put in there?
Yes,
And
so
what
we do have the
happens-
maximums here on the, oh, I'm sorry, can we go to the next slide? The max, oh, here we go, this slide, thank you. So this slide shows you the maximums that you can put in per year. And this does include any contributions that your employer may make. So you can see they have increased a little bit for 2019. So you see the 2018/2019 since you guys are at 12/1. So the maximum for 2018 for an individual that you could put in if you're under 55 was $3,450, and for 2019 it'll go up to $3,500. For a family, you can put in $6,900 in 2018 and $7,000 in 2019. If you're over the age of 55, they let you put in a little bit more for that catch-up period. So you can put in $4,450 for 2018 for an individual, $4,500 for an individual for 2019. And then you see the family coverage there too at the $7,900 for 2018 and the $8,000 for 2019.
And this would be applicable if you chose the Kaiser high deductible health plan as well too, these contributions.
Yes, this is regulated for every HSA. It's the law. Every HSA plan has these same. This is not done by Cigna. We don't determine these numbers. So then to make these maximum contributions in your calendar year, you must meet the requirements to be eligible for HSA by January 1st and remain qualified through December 1st. If these criteria are not met, then it becomes prorated on a monthly basis on how much will be contributed. So I think we skipped over the qualification slide, so we could go back there to tell them how they can qualify. Perfect, if they're eligible. So to be enrolled in the IRS qualified high deductible medical plan, by the first of the month, if your health plan is effective date after first of the month, your HSA will be established on the first of the following month. So for you guys in the room, you're a 12/1. So if you are enrolled in your benefits before your what's the deadline
11/15.
of 11/15, you will be in by 12/1. So this is more if there's like a new hire or something, they coming in on the middle of the month, or you're starting this in the middle of the month for some reason, it will take effect the first of the next month. You cannot have any health coverage, which is not a high deductible plan. So that's what I was saying. If you have coverage through a spouse, through a parent, whatever it might be, you have to be only on a high deductible plan to qualify for the health savings account plan. You cannot be claimed as a dependent on another person's tax return, so anyone under 26, and you're still on your parents, you can't be claimed, unfortunately. And then you must not be enrolled in Medicare, TRICARE, or full-purpose FSA to be eligible.
Does that make sense?
Yep.
So basically they're saying they don't, what's the Seinfeld episode, they don't want you double dipping.
Yep.
They don't want you to have an HSA, but I'm never going to take money out because I'm covered under my spouse's full plan for that.
Right.
The other one is that a lot of people, we advocate that you open up the health savings account and at least fund it with $50 or $100, because a lot of people say, well, I won't fund it until I have a health purpose. But if you do that, let's say that you don't fund it until that happens, and then January 2nd or 4th, you have to go to the emergency room. Well, you can't fund it then because you haven't opened up the account. Where if I just fund it with $50 or $100, then I could add the money in afterwards to fund it. Does that make sense?
Yeah.
So we just have to make sure if you do choose the HSA, that you do just fund it with a minimal amount. You can always add more to it later,
Right.
but you can't open it up after you've had an incident and use it for that incident.
Okay, next slide.
Any questions for anybody?
I have a quick question, if that's okay.
Yeah.
My name's Tori, and I am 25 and a half. So how does that work with, getting, I'm actually exactly 25 and a half today. So 6 months from now, I'll be off my parents' insurance?
Well, actually, oh, yeah. So when you turn 26, it's the first of the month following you turn 26 that you'll come back on the plan. You'll sign a waiver saying that you're covered by your parents' plan, so that when you have the qualifying event, you can come on board this plan. Does that make sense?
Yes, thank you.
Okay, so I think we skipped over the slide that shows the outline of the HSA plan. This is the pharmacy plan. I think we just need to go back one slide.
That's the only, that's the only
Okay.
slide I'm seeing.
If we go back, maybe it
Oh,
was
there we
right
go.
here. Okay, thank you. So this,
Yeah.
again, focusing on the in-network coverage, is the outline for the HSA plan. So again, still that open access plus network, but now you have that health savings plan to help you pay for the deductible here. So your preventive care covered at 100%. Primary, after the deductible is met, you have that 20/80 split. So that's the same for physician office, urgent care. You have to meet that deductible first before that 80/20 co-insurance kicks in. Your emergency room, after you meet your deductible, the 80/20, and your calendar year deductible for an individual on this plan is $3,500, and for a family is $7,000. So again, it's going to be that higher deductible because you have that tax savings account.
So the reason that HSA works is you kind of control your own dollars. Who goes on an HSA is someone who never goes to the doctor or someone who's going to hit the out-of-pocket. Why the out-of-pocket? Because now I'm paying with pre-tax dollars. Right? I'm paying with before tax instead of after tax. If you're on the HSA plan, you'd much rather go to the urgent care. Why? Because the cost is 1/20th of what an emergency room is. But even if we go to the urgent care, the emergency care is the last place that you want to get coverage. Number one, it's most expensive. And number two is you're there 6 to 8 hours, right? You're wearing a mask, people are throwing up. Every time another ambulance comes in, you're waiting 4 to 6 hours. There was a person that had asthma, and at 9:30 they had to go to urgent care. I mean, they had to go to the emergency room. Well, they were there till 3:30 in the morning. Whereas what you want to do is find out in your area what urgent care, I call them doc in the box, but what hours the urgent care is open. So if they close at 9, then, well, maybe I want to go in at 8:30 and just check it out if I'm having an asthma attack instead of doing that. The reason that you want to find that out is we live in San Mateo, and our urgent care is closed on Sundays. Like, really? You're closing on Sundays? I need you open on the weekend and closed Tuesday, Wednesday, or Thursday but that's just the way that they operate. So when you're sick, you're not going to look it up, but the emergency room is the last place you want to go because you're losing 6 to 8 hours and you're with everybody else that's very sick.
Exactly, and it's the highest cost, yeah. So we always say emergency room is life or limb. So use it if you absolutely need it, life or limb. Other than that, try to go to your urgent care, convenience care. We also have a telehealth option that I'll cover in a second. So you definitely have other options. That emergency room, life or limb. Yes, the highest cost, highest time spent. Okay, now we can go to that pharmacy slide, please. Thank you. So this is the pharmacy outline for each of the 3 plans. So you can see we have the HSA plan, then we have the Open Access Plus Low, or I'm sorry, we have the HSA, Open Access Plus High, Open Access Plus Low, and then your HSA on the right-hand side. So looking at your different prescription costs. So again, generic is going to be the biggest cost savings if your doctor prescribes you, you know, a name brand. Maybe try to ask if there's a comparable generic that you can take, because you'll see here definitely cost savings between our generic, preferred brand, and non-preferred brand. You also have the 90-day supply that you can do for maintenance medication. So if it's something you take on a regular basis, maintenance medication, you can get the 90-day supply there. It'll help you save money and then also help you so you don't have to go get your prescription as often. Out-of-network prescriptions are not covered on any of the plans. So make sure your pharmacy is in network when your doctor is sending your prescription. Next slide.
Does anybody have any questions on the prescription drugs or anything? Okay. So I'm going to go over the Kaiser plans. So the Kaiser plans are in the state of California if you're within one of their service areas. And we too have a high option, which is the Gold 500 and the Bronze HSA, because we wanted people to have a high deductible health plan. The nice part about the Kaiser high deductible health plan is that transparency. You kind of know Kaiser releases what their costs are. They haven't released the 2019 fee schedule yet, so we could, you know, what everything costs with Kaiser. For those of you that have Kaiser, no one's getting an answer, but has anybody used the teleform? You know, they can phone their doctor, Skype their doctor, email their doctor. So the nice part about that is on the Gold plan, and currently the Bronze, but effective December 1st, it's going to change. On the Gold plan, the cost is how much? 0, right? So Kaiser did a study, and they wanted to find out 58% of all Kaiser appointments are telephone, which is huge. But sometimes you have to go to the doctor, you just have to go. But if you don't, you can pay the 0 copay. So they did a exit survey to people saying, hey, look, why did you use the teleform? You know, and they thought the answer was because it was free, and it wasn't. It was traffic and time. Because if you have to go to a Kaiser facility and you want a 4 o'clock appointment, you have to leave early, you have to go, you have to park, you have to get out, you have to wait in the waiting room, et cetera, et cetera. And that's why 58% of all their appointments. And they're really seeing it now with pediatric care, with babies, et cetera. It's very hard to bring the baby out. You don't want them infected with the other room. And that's what's so great about Kaiser for that aspect. A couple of red changes you'll see. The complex imaging is reduced. The inpatient hospital is $600 a day for 5 days. So what that means to you is that if you're in the hospital for a month, the most it would cost you is $3,000. $3,500 if you haven't hit the deductible for that. It's a great plan. And the Kaiser Bronze is a phenomenal HSA plan. But just like the Cigna HSA, who uses the HSA is someone who always goes to the doctor and is going to hit their out-of-pocket maximum, or they never go. But either way, if you do the HSA, it really only works if you fund the HSA yourself to the maximum limits for that, because it's a tremendous savings vehicle. You get to deduct it off your federal taxes, not state for California. Other states may not deduct it, but it allows you to grow tax-free, and when you take it out, it's tax-free. So some people use it as a savings vehicle. They don't go to the doctor that much. They fund it. They start to invest it in stock, bonds, or mutual funds, and it starts to grow, and they'll use the earnings on that. So we know some people that they'll go to the doctor this year on the HSA, but they won't pay themselves out of the HSA till 2022, 2025, because they want the compound effect. They want their money to grow, and they'll take it out then. Does that make sense? So Kaiser is a different healthcare delivery system. Okay, you usually love it or hate it, no in between. But it's a different than your uncle's. It's not your uncle's Kaiser anymore. It's a totally rebranded effort. If the private healthcare industry is not working for you, such as Cigna, then you may want to take a look at the Kaiser. It's a different healthcare delivery model. But for those people that work, they just like going in one spot to get their X-ray, their labs, their MRIs. We had a person this morning says, "I'm going to leave Kaiser." Like, why is that? So I don't like my doctor. Well, you know you can change doctors, right? For that aspect. But Kaiser is an excellent alternative for you. You love it or hate it, but it's not the Kaiser that you knew before. They've tremendously transformed it.
So so when we file our tax returns, how does the IRS know that we're enrolled in a high deductible?
Because they get.
Yeah, they get that form that what 1095, I think.
Yeah, you're right. 1095.
Yeah. So we don't have to attach anything.
So what you'll do is you'll get from your HSA administrator. You'll get how much you put in, and then you have the form as well too. Because you get the form every year. You guys get the form of what you elected, and it has it on there. The government cross checks. Again, I just had a person this morning that they were on the low cost, the best premium plan, that wasn't a high deductible, and it's like, you need to go back and resend that because they're going to catch you if you do that. You have to belong. It's called HDHP, high deductible health plan. You cannot put money into, well, I guess you could, but you can't legally put money into an HSA account unless you're enrolled in the high deductible health plan.
And Kaiser is available only in California, right?
What's that?
It's available only in the state of California, right?
Yeah, and actually one step further, if you're in a service area, there's some service areas that Kaiser is not in. But yes, okay. California. Okay. Any other questions on the HSA?
Sorry, my name is Keenan. I live in Maryland, close to Washington, D.C., and they have a Kaiser here in Washington, D.C. I can select Kaiser there or not?
No, it's only California Kaiser. They're not. We're on the Kaiser Input Council, and we've asked for national brands, but they're not. The Kaisers are not connected, so they won't allow it.
Okay.
If you live out of California, your choice is one of the 3 Cigna plans.
Okay, I have the Cigna already, so thank you.
Okay. Any other questions, anybody? Have we explained it correctly? Does anybody have any questions? Go to the next slide. So this is more.
Yeah, so this is more, again, tips to save money. So we talked about the in-network. We talked about avoiding the emergency room. So on for Cigna, again, we're back to the Cigna plan. You can find, for prescription drugs, a list of covered medications on mycigna.com. You can also convert your maintenance medication to mail order. That 90-day can be either retail or mail order. So then your prescription just shows up at your doorstep. For provider choice, you can use the healthcare provider most appropriate for your care. Use Cigna designated physicians when possible. Again, that in-network option. And then using preferred labs to save money. So finding a lab in network as well. Everything that you're doing, you want to try to stay in network to make sure that you can save money for all of those. Emergency room, used for true emergencies. So again, life or limb. Don't wait. Locate a convenience care clinic near you now. So just as Ron was saying, look it up now. So when you need it, you know the closest one. For proactive measures, utilize the health improvements tools available to you. So on mycigna.com, we have My Health, we have My Plans tab and a My Health tab. Under the Health tab, you'll find online coaching programs, tools and resources for health improvement. And get information on the cost of treatment to ensure there are no surprises. Again, on mycigna.com, there are calculators to help you know before you go what kind of cost you can expect to pay that your doctor charges versus maybe another doctor or facility in the area. And utilize your preventative care benefit. Again, all plans that's covered 100% no cost to you. So make sure you're going to the doctor for those preventative care visits.
So every time you go to the doctor, I want you to ask, are you an in-network provider? Okay? because we just had somebody again this morning where they got surgery last year and the doctor was in network, and they got surgery this year, but they didn't ask, so the doctor was out of network. Talk about a change of pricing. So every time you go in, don't say, do you accept? Don't say, do you take? But say, are you contracted in network? Because these guys will accept 2 doses of chicken and a MasterCard. When you use the words accept or take, you want to say, are you contracted in network? Because if they're contracted in network, the fees are discounted and they have to go by those fees. But if you go out of network, there's significantly more of the cost is borne to you. So every time you go in, are you still contracted in network is the phrase. Just like the lab work, right? The most expensive lab work I can get is one done at a hospital. I want to use an outpatient clinic. Are you contracted in network is the phrase. Does anybody have any questions on that?
So if a clinic is in network, that means the doctor is also in network, or we have to check for individual doctors?
No, it doesn't mean that the doctor's in network. You want to make sure your doctor's in network and also the lab is in network. So just because they have a lab within the hospital that the doctor's in network with does not mean that that lab is in network for your plan. So you'll want to make sure each different facility that you use is in network.
Okay, so we have to make sure the doctor is in network and the lab is in network, not to worry about whether the facility, I mean the clinic, is in network.
You just want to make sure wherever you go that you're seeing an in-network provider. It's kind of like if you were to get surgery, you would want the doctor to make sure they do a pre-authorization, right? Just like anything else, you want to make sure it's pre-authorized. It's kind of, for those of you that have been on insurance, it's nothing changed, just to make sure the doctor has done the pre-authorization. Anywhere that you go that gets work done, you want to make sure that they're contracted in network. That's why we're kind of steering you towards the urgent care. Find out what's near you, what hours they're open, what's contracted, so you can take a look at it.
Got it. Thank you.
Okay.
Next slide. So a couple more resources that Cigna has to offer. We have our Coach by Cigna app, which is online coaching programs that focuses on 5 lifestyle areas of exercise, food, sleep, stress, and weight. So this is a separate app from the My Cigna app that you can download and have access to. Next slide. So this is the telehealth I was talking about. So this is where you have 2 options for telehealth. These can be video conference calls with your doctor, not your specific doctor, just a doctor. So it's not going to be your doctor FaceTiming you or calling you, but a doctor you can get in touch with over the phone. So say you woke up, your kid has pink eye or something, and you want to, get a prescription sent to your local pharmacy. You could use telehealth, and this is going to be the, we talk about the emergency room being most time, most money spent. This is going to be least time, least money spent. So again, we also talked about finding your convenience care clinic, ahead of time. Sign up for these ahead of time before you need it. So you're not trying to find the instructions when you need it on how to sign up for the telehealth service. You have it ready to go in case you need it for any reason. So then we also have our gamified health assessment. So this can be done on the health tab of My Cigna. Again, it's confidential information. No one sees your answers. But it'll help generate some recommended programs that you can complete within our coaching to improve your overall health and wellness. And the My Health tab on Cigna.com. So this is where you'll find the health assessment, the online coaching programs, and other resources for you to improve your health and wellness as well. So I would recommend, utilizing some of these. Again, they're covered in your plan. It's online support for you to become healthier if that's something that you're looking to do. And our apps and activities. So this is similar to the My Health tab on MyCigna.com. This is, again, a separate app. So you'll have the My Cigna app and the Apps and Activities mobile app. And this is where you can access online coaching programs for Cigna. You can connect a device to track your physical activity. You can set up walking challenges to do and compete against your coworkers. So again, more resources for you to work on health improvement. And then we also have support for your chronic condition. So if you do have a chronic ongoing condition or your family member on the plan does, for any of these conditions, you can get additional support through Cigna and work with our online coaching programs to maintain your healthy lifestyle, and then get additional resources as well, and work with like a case manager to help you make sure that you are utilizing the correct services for your condition. And then we have our Healthy Rewards, so some additional programs that you can participate in through Cigna, eye care, and then weight management programs through Jenny Craig at a discount. There's smoking cessation programs, hearing care. We have discount on fitness club memberships, alternative medicine, and then mind body, focusing on help lose weight, control stress. So those are all, again, available on the My Health tab or the Apps and Activities mobile app.
And for those of you on Kaiser, Kaiser has classes, for diabetes, weight management. That's the beauty of Cigna, that in this space, in your size company, under 100 employees, Cigna's the only one that does this. Everyone says that if you have your health, you have everything. Well, that's not really true until you get sick. Then you realize what your health is. And that's kind of what this is trying to do, is to, an ounce of prevention equals a pound of cure, is kind of doing these items for that. So both Kaiser and Cigna do a total holistic approach. Next one.
And then this is how to get in contact with Cigna if you have questions. So we are available 24/7, 365 at this phone number. It's also going to be on the back of your ID card if you need to contact someone. You can go on mycigna.com. That's where you're going to find all the resources. So your coverage, cost savings tools, your claims, your medications, all of that is going to be on MyCigna under My Plan tab. And then we also have our mobile app as well, where you can find in-network providers, see your claims and all of that on the go on your mobile app.
So what you want to do is download the mobile app now. So if you're in Los Angeles, you're not feeling well, where do you go? Where's the local urgent care? That's why you want to download it now. Nice. And the same thing with the kp.org. That's what we talked about. For those of you that have it, it's email, Skype, video chat, text pictures. Is it a spider bite? What exactly is it? Same thing. Next one. Same thing. It's the same thing. It's download the app now when you don't need it. So when you need it, you're not fumbling for it. Okay. Next one. And it's the same. That's why we chose Cigna and Kaiser. They're both doing the total holistic approach. Next one. And it's what we talked about. Again, they also have, for those of you that have diabetes, they have weight management classes, they have cardio classes. Anybody that gets cardio, they enroll them for you. It's absolutely phenomenal at the Kaiser facilities for that. Next one. Any questions or anything? Anybody have any questions on there? Biggest takeaway is, if you're on Cigna.
Hi, Umpar. Into legacy profit center, right? So as far as this mapping is concerned, where does this mapping, which program needs to pick that up? Is that the RAR program or which program? It's not an RAR program. It's in S4.
So we need to have mute. One of you is on mute.
Yeah, there was discussion going on with some Pascal guy who knows that program name and the zip transaction name also, like where it has.
Oh, there we go. Thank you. I'm gonna try to find him. Any real questions? Any real questions?
I have a question for the Cigna. I saw the one slide where you said I think it was like the slides before the Kaiser one.
Yeah.
About, I think right when we're on the mobile app section.
Yep.
You mentioned about the discounts for the alternative medicine.
So if that's something that's covered in your plan, I do have your
So,
benefit
I
summaries
do
as well.
see it, and let's just say for both of the low plan and the high one, they're both covered like 20 visits. So you mentioned on that one, discount, is that for like out of network type thing, the discount?
No, so that would be if it's covered within your plan.
Okay, so that's the one you're referring to.
Yeah.
This. Okay.
Which is a nice benefit because it's not always covered. Any other questions on the phone?
If you do not have any other questions, I just want to thank Caitlin and Ron, and I want to remind everyone that any changes need to be completed by November 15th. The instructions are on the open enrollment announcement. I think it's page 5. If you are not making any changes, just go through the next on eCentral and sign your document, and that will take care of it. And if you have any other questions after this meeting, feel free to reach out to me, and I will certainly try and answer your questions or get back to you with the answer. Thank you, and we'll have an enjoyable evening. Bye.
Thank you, everybody.